up, everyone? Welcome back to another episode of Kinda Different, a podcast where we talk about innovation in dental and healthcare. We connect with some absolutely amazing people, and we talk together about how we can all make healthcare and dental care more human. And today, I am super excited to be joined by somebody who is making a big splash in a space that I think a lot of us in dental care haven't thought about. So excited to introduce him in just a minute. I'm Dr. Matt Allen, CEO and co-founder of DifferentKind and the host of Kinda Different, and just super excited to have Joe Thurman on the podcast today to share with you all what Interview IIA is doing, how they're thinking about how their solution makes healthcare different and better, and just generally one of the nicest humans I've met in a long time, and especially as another founder in this crazy entrepreneurial healthcare space. It's just always great to connect with people like Joe. So Joe, thank you for taking the time. Would love to have you just give us a quick introduction of yourself and tell us a little bit about Interview IIA and what you all are building.
Yeah, awesome, man. Founder to founder, that means a lot. And you, I'm right back at you as far as nicest guys, great guy to collaborate with as a founder. So excited to be here. Interview IIA, yeah, we are focused on helping to change the way that people think about building teams, right? And we've launched IIA Healthcare, which is obviously just our product in the healthcare space, really because we believe that we can truly move the needle in the healthcare space in helping to think about the teams that can provide the right care to the communities that they support and where they reside. And so we're predictive hiring software. When you're thinking about hiring any number of roles at scale, we focus on helping organizations gain a level of mastery in their ability to do that. So that if you're hiring for, in the hospital space, an anesthesiologist or something like that, it's interesting how the floors or the departments or the organizations don't even talk to each other, right? They're part of the same core organization, but you and I aren't communicating about the great talented people that we're talking to who want to be a part of this. And that happens with dental assistants or any types of thing where you're hiring a role that is truly impactful and has a truly material impact on your business and the outcome of your customer or client or community. And we need to find a better way to do that. Build great teams, people who stay, people who want to perform, people who are passionate about the work, and going far beyond just making sure that they have the right credentials. And that's what we do. That's what we're excited about doing, is building great teams in healthcare.
I love it, man. I love it. And I have so many questions, and I know that so many of our listeners are going to find really interesting insights from what you say, and probably in the Interview IIA product as well, right? So let's dive in. Let's talk specifically first about innovation, because I think you actually have an interesting perspective from the fact that you're not a physician, right? You haven't spent your whole life in healthcare. You've worked in other industries, and your product can be applicable in other industries as well, right? So what do you think that the biggest thing that healthcare and dental care specifically can learn from innovation that's happening in other places that we could apply? And then kind of how are you operationalizing that in your work to take those learnings from those outside spaces and put them into, hey, now healthcare, you can have access to this?
Yeah, I love that question. I mean, the reality is there is 40, 50 years worth of research that shows that standardized interviewing, measuring the conversation in a structured way, is the best method for driving prediction of performance, right? And so there's other industries that have tried to really develop structure around what are we measuring? What are we looking for? How do we measure this meaningful conversation? And how can we get predictors earlier in the process before we make a very high stakes decision of who's going to join the team? So there are organizations that have been doing that. There's a ton of research about how you can do that. And in healthcare, the challenge is even more complex, right? You have the credentialing process. You have all of the things that actually are very valuable. Looking at, yes, I have the credentials, I can show up, I can do the job. And sometimes healthcare, I think, falls prey to looking at that as 90% of the hire or the conversation, and then the values-based, do they align? Are they here for the right reasons? Part of the interview, or why we select people, gets left by the wayside, right? It's an afterthought. And that is at the heart of what drives to retention, performance, and quality of care, and all the different things that we're talking about. And so how can we introduce a way to enable this fast-paced world of healthcare dental care, others, where they're always doing a job. They're not sitting in front of their computer all the time. How can we give them technology that reduces the errors that they'll make, that guides their conversation, that turns it into something far more objective so that they can trust it and be better at that interview job? They have they have plans for everything else, medical plans, dental plans. They need a hiring plan. And currently, usually it's a notepad and a spreadsheet and something else at best. So we're trying to take all of that selection science that exists in other industries and bring it into a meaningful way that healthcare can deploy it at scale.
That's amazing. I mean, I think I just kind of actually realized it's funny. We've been talking for a long time. We've been friends for a little while now, and we both measure conversations in different ways, right? Like you're helping measure that on the front end from the interview perspective. We're helping measure that on the patient end, but we're both trying to measure those really critical conversations and say, hey, here's what the most important things are, and here's where you need to focus. Which I actually just realized. And so, I mean, I absolutely, I've always loved your product, but man, I love it even more now.
We mirror each other a lot. Yeah, a lot of similarity there.
Right? Yeah. So you guys have been doing this for a little while. You've rolled out your product. People are using it. It's, you're seeing good success, right? Like, what is something that excites you just as the founder that you're like, hey, this is something I'm just super pumped to be working on. Maybe it's a specific project within it, or, kind of some company initiative or something like that. But what's something specific that just like makes you stoked to get out of bed in the morning right now that you guys are working on?
Yeah. I mean, for me, it's the conversation around bias mitigation and culturally competent care, right? So my background, I've been in talent for 20 years, and that's everything from like recruiting to helping organizations and training with unconscious bias and all this other kind of stuff. And many organizations struggle with their why behind like anything inclusion or diversity related. In healthcare, it is such a powerful conversation when we have research and data around the fact that understanding someone's religious background impacts your ability to explain a medical plan to them and drives the adoption of what the family might select moving forward for their child or for their spouse. Like that is something that as a founder, we all want to solve big problems, but when you can really attach like such a powerful why that's already happening. We didn't create this why. It's already a conversation in healthcare. There's a ton of research behind it. And now there's actually a space for us to fill with our technology, with our passion, with our knowledge, where there's just meaningful outcomes to community, like to humanity. Like it's cool to like sell products and do all this as a founder, but when you can actually really find that connection to an impact you can leave on society and healthcare and dental care and all the things of us taking care of ourselves as humans, if we can move that needle 1% in how X community is receiving care because of our product, like that gets me excited. Like that's just more exciting than solving a problem for a call center or something like that. In my opinion, nothing wrong with like people solving those problems, but for me, it gets me more excited. Like what we're doing in the healthcare space. I love it.
That's amazing. And I think it leads really well into like my next question for you, which is really just more around you, right? Because you've mentioned a little bit about your background and whatnot. And I just love the intentionality that you bring to every conversation that you have. But I'm curious to how that actually like, impacts your company. Like what values, as founder, have you like really set out to say, hey, this is who Interview IA is going to be. This is how we're going to operate. This is how we're going to like operationalize those values. Like we'd love to just hear a little bit more about, that kind of vision piece from you and how, how that hits the pavement actually when you're out there, like making it happen.
Yeah. I mean, whenever you decide to become a founder and start your own, venture, whether it's a solopreneur, entrepreneur, like they're both challenging, they're different, depends on whether you're trying to scale it or just have an impact and be solo. You have to be driven by like something bigger, something that connects you to other people in a very meaningful way, right? Whether that's building a culture where people will thrive, whether that's building a product like we're talking about that will change things. And it's usually some version of both, like it's a mixture of both. And for us, I think it was a very strong mixture of both. Like, how can we build a company that can have an impact on our local community and like elevate people and bring people from diverse backgrounds and mindsets into solutioning? Because that's the best way to build a collaborative team, is that we all took different paths in life and have different journeys. And then how can we turn that into something that actually people want to consume? And for me, it's trying to always grow, always expand, and always encourage that for the rest of the team. Like the vulnerability, like that you can have as a founder. I think it's a luxury to be a founder where you can be vulnerable, because you can't get fired for being vulnerable and like saying exactly what you feel, right or wrong, right? And I know that like Brene Brown talks about the power of it, and I used to think of it as like this something you had to like hone and figure out. But as an entrepreneur, I think it's like we're lucky that we just get to be vulnerable. Like if we just want to talk about the pain we're feeling, we find another founder and we talk about it, and it's part of our journey.
Yeah.
So long-winded answer. I don't even know if I really answered your question,
Great.
But like bringing all that to life, because I just think we get stuck in showing up to work and just kind of doing a job. And we've all been there before. I know I have been. And life's bigger than that. Like find your way to have impact. And if you're a founder, find a way to give other people an opportunity to have impact. And I think that's just what I try to live by, and who I try to surround myself with, those types of people.
I love that. I mean, I think it's especially so valuable in dental care, where there are so many, it's like every practice owner that's like owned a solo private practice, right, is also an entrepreneur. Like, totally. And, if you're owning a group practice, right, then it's, just you're owning more practices. So there's this element of like providing care, being a business owner, right, that I think so many people, certainly in our audience, can probably resonate with. So I love that. I want to hit specifically just on like, I can't ask anyone else this question, only you. Well, I guess I could, but it probably wouldn't be as insightful, right? Okay. But like, I just wonder if there's like one specific interview that you've ever been the interviewee or like seen or like whatever, where you're like, holy cow, either from like a good or a bad perspective. I probably would prefer the good, but if you're like, holy cow, I have this story to tell you about this terrible interview this one time. But I would just love like a story of something that you've sat in on, whether that was as the interviewee or as an interviewer, where it like really sticks out in your mind, and why, what did you learn from that specific conversation?
I probably do have more bad than good stories, unfortunately.
That's what you're solving, right? You're solving for those bad ones, hopefully. So.
Yeah, I've seen everything from like people moving, like when it was in-person days, people having interviews in 5 different conference rooms because they're quote measuring the swagger of some individual. It's these weird subjective things that you just cringe when you hear like, what exactly are we trying to do here? Yeah. I've been a part of an interview where there were 14 people in the same room conducting the interview. Like it was a leadership interview, but still like that's a little over the top. So I've seen those things. I think, a good interview, a good interviewer, which honestly, it's really what we're trying to replicate. There are people out there who have it's what you're doing with podcasts, right? We call interview questions prompts. And so you put out there a prompt with a deeper meaning behind what you're trying to measure behind that, and a lot of intentionality. We just call it intent behind every question. You should be measuring in some way what you are, something meaningful behind every question. And there are people who just really are great at that naturally. They're great at driving conversation and documenting something in an objective way based on the prompts that they're using. And you just see some great leaders who get there. And what we sell, the fact that we sell to those leaders is you can't scale that. Like you have to document that and build that for your team so that we can all be thinking about intelligent questions, engaging questions that create a great candidate experience, but have meaning behind what we're trying to measure. And so I think we see it in other use cases more than we do in job interviews. Like a lot of times, if your company's struggling to hire people, then people err on the side of spending an entire hour selling the individual on why you want to be a part of this and not measuring anything. Or you have teams that spend a whole hour grilling someone and run them through, quote, the gauntlet. And usually it's some extreme until you can actually standardize it, because we're all trying to do a good job at this game. Like if you had to decide, did you want to hire me into DifferentKind right after this 30-minute call, you'd be like, I like Joe. He's cool. I think we could hang out and that doesn't actually translate into a predictor of hiring. Yeah. And so I think, the reality is most of us suck at job interviewing, and we need help in organizing it when we're having to do it a lot. And so it's just it's a hard job.
Totally. Yeah, I think there's a lot there. I mean, we can unpack a ton of that. And maybe we will in a future episode. I don't know.
Let's do it.
Yeah, we can have it back, right?
You know where I'm at.
There you go. Well, let's move into like the idea of making healthcare and dental care more human. Because I
Yeah.
think it's not something that a lot of people think about, especially on the front end, right? Of like, okay, well, whoever's there, that's their job to make them, that's to make that experience as good as possible for the patient, right?
Yeah.
Um, I think really high performing organizations certainly are thinking about the fact that, like, yeah, if you get the best person possible into that seat, then the patient experience is going to be much better.
Yeah.
But how specifically do you feel like you're making healthcare different, and how do you feel like you're making it kind, with the work that you're doing? Those kind of related questions, but maybe there's a different answer. Like, how is it different? How's it kind because of what you're bringing to these healthcare and dental care organizations?
Yeah. Well, making it more human is so. I'll go with even why our name at the core is Interview IA, or IA Technologies is our full corporate name.
Mm-hmm.
But it's fun to Google AI versus IA. Like topics will come up where IA is basically intelligent assistant, intelligent augmentation. It is using technology to support humans and reduce the errors that we make. Think driver's assist versus autonomous vehicle.
Mm-hmm.
And so I think that conversation is only getting bigger now as we think about generative AI and where you should actually use AI to replace a human versus where we should use it to make it more human. And that is, I think, at the heart of what we're trying to do, right? Is thinking about, especially like in the bigger healthcare conversation, moving away from fee-based care to value-based care. And the only way you do that is to make it more human, to make someone care more about the health of Matt and the health of Joe, and less about the chart and the next potential thing that we could charge for, because we do have to make money as healthcare organizations.
Yep.
But it's all about that person and why they're there, right? It might be, I'm not going to say it's outdated, but let's go with the Simon Sinek thing that we've all been talking about for the last decade, right? Ever since, and before, but he made it popular, about know your why. And that why, being able to get to why someone wants to provide care through your organization for your patients. That is so important. And unfortunately, I think many of us have had a bad experience from like a customer service perspective at a dental care facility or a medical care facility. I'll tell you, that makes all the difference, right? People then might change providers, and then like you're starting all over. And making it more human makes us healthier, like makes us take better care of ourselves, makes me make sure that I'm coming back for all of my planned checkups, my cleanings, my other things, because I actually enjoy the service that I get there. And so by making sure that we're selecting humans, not credentials, those humans will then care for our patients in a more humane way, more kind way. And that's really our philosophy. Is at the heart of it is like humans are the power behind every important company and every great value that we receive from a business.
I love it, man. You're talking so much about trust there. And that is my last question for you. Like, just to imagine, putting yourself in the patient role, because we're all patients, right? We all have to access healthcare, right? We all hope to go to an organization that has put as much time and energy and thought into like designing the interview process as they have to, designing the patient experience and all of those pieces, right? Because it all makes a difference. But when you think about yourself as a patient, what's one thing that you kind of, just for you, just for Joe, like really helps drive trust with you, where you're like, hey, this specific behavior, this specific thing that like this healthcare professional does really helps me to trust them. Is there something that you could share just from your experience that really drives that trust?
Yeah, hands down, it's empathy. It is understanding that usually, or not always, but a lot of times, if we are in a position where we need care, we might be fearful, we might be ashamed, we might be any number of emotions, right? And like interacting with individuals on the other side who have the ability to empathize and not just haven't become jaded, I guess is kind of a way that you think of it, in their day-to-day work, I think for me is a game changer, right? Because they will talk you through, they'll be more patient, they will work with you, they will actually help you with putting together plans and thinking about personalized care. And again, that's back to what you're talking about. They make it more human. Though you may do this procedure X number of times in a given month, this is the only time I'm receiving it, right? This month, hopefully, and maybe
ever, right?
ever, right?
Yeah.
And when you feel like they understand that in healthcare, I just think that is so powerful and something that improves, the quality of care that any of us receive. But for me personally, that'd be my answer when I look at when I describe what I look for.
Yeah, what matters to you. Well, Joe, I absolutely love this. And I think that there's so much that you're doing here that really does make a huge difference to so many healthcare organizations and hopefully more and more dental care organizations as well. I think, what you guys are doing is just super, super important. And I think dentistry itself is just experiencing a big challenge in this area right now. So if your technology can help dental care organizations be better in this way, man, I think that they would greatly benefit. If anyone wants to talk with you or find out more about Interview IA or whatever it is, how do they get in touch with you? Kind of give us, hey, find me here, go here, tell us where to go.
Yeah, best place to find me is on LinkedIn. That's generally, like, as far as social platforms, that's where I'm at. Our website's simple, IIA Healthcare or Interview IA, both will get you to us. And yeah, we'd love to talk and co-create and collaborate with people who are trying to have an impact in the overall broader health conversation. So, dental, healthcare, other things in that space. But yeah, just honored to share space with you today, man. And good friend, and great to do this online.
Totally, man. Just so grateful that you're willing to join us. I think it is, like I said, it's probably an overlooked area for a lot of organizations of like, we just kind of like interview people and we don't have this process and we don't, put a ton of time into it. And obviously it's just so crucial. So I'm so glad that you took the time to join us today to share your knowledge with all of our listeners. And yeah, man, just really respect who you are as a human. So thanks again. And hopefully, like I said, maybe we'll be able to have you back on in the future.
Awesome, man. Same.